Okay, let's just see the general differences between an artery and a vein. If we look on the right side, we'll see the structure of an arterial wall. Now remember, the whole vascular system, whether you're talking about arteries, veins, the lining all within the heart, that is called the endothelium. That is like a very fine saran wrap that's lining all the chambers of the heart and all the vessels in the body. So, and it's a lining that tries to prevent things from clotting to it, and it's a protective lining that's continuous throughout the whole cardiovascular system. Okay, so look at the artery. It has a thick wall. Okay, it has significant muscle to it. It has a thick wall because arteries typically have high pressures in them. They have blood under much higher pressure than a vein. As well, arteries have the ability, and they want the ability, to vasoconstrict or vasodilate. And there's a number of different chemicals that can cause an artery to vasoconstrict, such as, how about norepinephrine in the sympathetic nervous system? There's also nitric oxide, which is a chemical produced in the endothelium that can also vasodilate. Because there's constant vasodilation and vasoconstriction of the arteries and arterioles to control flow to different parts of the body, and also to control overall blood pressure. So the arteries are like the powerful, thick pipes that really don't want to leak. So they're made with significant muscle there to protect, and also a significant lining around them to protect against leakage, and also to allow them to vasoconstrict and dilate to control flows to the brain, to the heart, to the legs, all over the body, because it's constantly adjusting the blood pressure. Now look at the veins on the left, or the vein, which is in blue here. Pretty thin lining of the entire vein, and pretty small little muscle there. There's very little. So veins are can be easily cut or damaged, but they're under low pressure. Veins are returning blood to the heart. That's a low pressure system. So I'm sure you've seen when you cut yourself and it just oozes. That's just a vein that's bleeding. If you cut yourself, it's an artery. It's going to be a totally different type of bleed. It's going to pump. You will see it spurt up into the air. It's a significant pressure in an artery. Okay. And the other thing to remember around the body is veins are usually more superficial. The body is very smart. It made the veins superficial. It made most of the arteries deep in the tissue. And why did it do that? Well, for survival. It doesn't want you to cut an artery. If you cut an artery, or if you injure an artery and you bleed from it, you can easily lose your entire blood volume, which is 5 liters for an adult, through a hemorrhaging artery. So the veins, you can put some pressure on them and they tend to stop. A couple of examples where this isn't the case, where the body's taken a bit of a risk, is the arteries in your neck. Well, the carotid artery is not that deep, so that's a bit of a risky area for the arteries that are traveling to the brain. The other one is the femoral artery in your groin. That's superficial there. It's not deep in. So a groin injury or a stab injury to the groin you could easily puncture the femoral artery. So those are two risky areas of the body. But in general, arteries are deeper than veins. The other thing to remember is that arteries have oxygenated blood in them, and they pump away from the heart in general. Which artery doesn't have oxygenated blood in it? It has deoxygenated blood. And that's the pulmonary artery that's going from the right ventricle to the lungs. That has deoxygenated blood that's going to the lungs to be oxygenated. Another difference is that veins can have valves in them. So the veins in your legs, they have valves in them so when you're walking and the muscles of your legs are contracting, the veins are actually being squeezed to get the blood to the next level in the vein as it returns back to the heart. Because remember, it's a low pressure system, so the blood in all these veins in your leg have to get back to the heart. So there's valves in them that allow one-way direction. The flow is back up the leg, and then if the flow slows down because you're not walking as much anymore or you're not contracting the muscles, the valve will stop it from flowing backwards. So the valves allow for one-way flow. So that's an important concept, because you can imagine if these valves are damaged over years or from damage to the veins, you'll get flow that can't get back up the leg, and that can cause swollen legs. Will often provide people with compression stockings if they have varicose veins, for example, where a lot of the valves are damaged. We'll prescribe pressure stockings to reduce the swelling of the leg and also to help with venous flow up the leg back to the heart. Okay, so let's talk about venous insufficiency. And when we talk about venous insufficiency, we're usually talking about the legs. So the veins in the legs have to return the blood back up to the inferior vena cava and then finally back up to the heart. So in order to fight against gravity, which is constantly trying to force the blood down, the veins have valves in them. And the valves allow for one-way flow. So as the blood gets to the next level in the vein, the valves stop it from going back down. It's a one-way flow. So if you didn't have this system, it would be very hard for the blood in the veins to get all the way back up into the inferior vena cava and then finally the heart. The blood would just pool in your legs, which does happen in certain conditions. So let's look at risk factors for venous insufficiency. So if you've had trauma, so say you've had, you're in an accident years ago and both legs were broken, and you had blood clots on both sides of your legs in your veins, and that damaged the veins. Not only did it damage the fine endothelial lining that I mentioned before of the vein and it scarred it, but also the valves were damaged. So now you're left with weak valves in the veins, leaky valves that don't allow for one-way flow. So you're gonna have pooling of your blood into the legs. You'll have edema. What about obesity? Well, obesity adds extra tissue all around the veins within the legs. You can imagine, so if you can imagine yourself sitting when your legs are bent, and of course you're bent at the hips too, those veins can be occluded. They get blocked because of all the extra tissue, because veins aren't under high pressure. So when they're occluded at those areas because of obesity, the veins are under more pressure because they're temporarily kinked there, and they're constantly dilated, and that leads to damage of veins, just like stretched veins, and the valves have been damaged because they've been under high pressure. So obesity is another one. Pregnancy is, so as you get more and more pregnant, it's not uncommon to get a bit of swelling in your legs. And why is that happening? Well, there's constant, so as you get more and more pregnant into the third trimester, the inferior vena cava is now getting pressure on it because the fetus is there. So that back pressure goes into the legs, which causes distension, dilation of the veins, higher pressure that the valves have to deal with, and you can get some damaged veins and valves, leading to edema in the legs in pregnancy or swelling, but also later on it can lead to permanently damaged veins in pregnant women that have had multiple children. Prolonged standing, same idea. High pressure in the veins from standing all day, so due to gravity, puts more pressure within the veins, and it stretches the veins out, and it also can damage the valves. So all of these can lead to venous insufficiency, chronic swelling of the legs, and as well what are called varicose veins. So varicose veins are abnormally dilated veins. You often see them on the surface of the leg, and they're due to chronic high pressures and weakened valves from any of the above conditions. So just as an aside here, when you're taking a flight somewhere, and it's a long flight, say it's 6, 8, 10 hours, it's recommended that you actually get up every hour to an hour and a half and just walk the aisle. Why do you do that? Well, you've been sitting down for an hour and a half. Your knees are bent, your hips are bent, so there's two areas that are kinked in your legs. This predisposes you to getting a DVT, a deep vein thrombosis. Getting up every hour to hour and a half reduces that risk, because when you get up and you walk, all the muscles around the veins contract for you to walk, and they are what actually cause the flow of blood within the veins. It's the muscular contraction of all the different muscle groups around the veins that actually squeeze the veins and push the blood back up towards the heart. So movement and walking reduces the chances of a deep vein thrombosis, and that's why we try to get people up after surgery as fast as possible. So the lower part here, so as your veins become more and more dilated from whatever condition you have, whether it's obesity or trauma, you have high pressures in the veins. The blood flow is much slower in the veins, and you get swelling of the legs with venous insufficiency. If you get swelling of the legs, you're at much higher risk of getting ulcers in the legs. Swollen legs with a lot of fluid, a lot of edema in them, is a risk factor for venous ulcers. And we call them venous ulcers because the underlying reason why you got the ulcer is because the veins aren't working properly. So you can have arterial ulcers, and that we'll get to, and you can have venous ulcers. And they're both extremely hard to treat. So venous ulcers on the leg are treated by getting the swelling down as quickly as possible. So leg elevation. So in order to elevate your leg, it has to be above the level of the heart. So basically the patient has to be horizontal or at a low incline in order to get their leg above the level of the heart, to allow for flow to go from the legs back to the heart. We use compression stockings to increase the pressure that will force the veins to flow the blood back up towards the inferior vena cava. We use devices that we put on people's legs that compress, like it starts compressing at the foot and then the ankle and then the calf. It's called serial compression. So inflatable compression devices, and they're really neat because they help compress the blood out of the legs and reduce edema. And sometimes for varicose veins, there'll be surgery. There'll be vein stripping that will just remove the veins and allow for other veins to get the blood flow back to the heart. So what's sclerotherapy? So this is basically we inject many areas of a chemical that scleroses. It scars down the vein that we want to get rid of. So it's usually varicose veins. And we inject many sites that scar down the vein so that there's just no flow in them. And the varicose veins, because they're not getting flow anymore, they're not dilated anymore, and they're not functional. So sometimes it's done for cosmetics only. You just don't like the look of all these dilated veins and you go for sclerotherapy. Other times it's because you're getting repeated venous ulcers. And the sclerotherapy is to try and get rid of all these damaged non-functional veins.